This is Pet Life Radio. Let's talk pets.
We are here live. Now you can hear me. Both of you can hear me. A request came in. So, hello, B. How you doing? Stephanie, hi. Good morning, everybody. So, anyway, let me just start my show here on Pet Life Radio. So, we're live here for the next 30 minutes here on Instagram and Pet Life Radio. Here for you, here for your pets. You know the drill. And if you need to get a hold of me here on Instagram, just type away. Love to hear. Hey, Steve. And review request. I'm going to, is Redmond key. I'll accept it, but I don't know. A lot of people hit that, for some reason, hit that button accidentally. Then when I say, okay, I'll take in, they say, no, it was a mistake. I don't want to do it. Anyway, we're here on Pet Life Radio. You can get me easily, 877-385-8882. They're the 38s, 877-385-8882. And you can ask away. And hopefully you have some questions, things you want to talk about. I always have things to talk about, but hang on a second. Let me just review the request and see if we want to go live and see if they want to do it. How's the risk? Well, the risk is, I guess, okay. I know my good friend, my doctor, Robbie, who is a hand surgeon. I'm going in tomorrow. They're going to take this. It's a soft wrap, but it has like a plate in here to try to keep my thumb. Unfortunately, if my patients were as bad as I am as a patient, I'd be in big trouble because I am terrible. So I'm not supposed to use it at all. And I cannot not use it. It's impossible for me. So anyway, they're going to take this off. He's going to take the stitches out from the surgery. And then he's going to put me on a hard cast, which I won't be able to probably. I mean, this got, over time, it was a soft wrap, so I got a little soft. I'm using the hands way too much. I'm using my thumb way too much. I'm not supposed to at all. So it is what it is, but we'll see when he takes everything off how it is. So anyway, what's the best way to firm a dog's loose stool besides pumpkin? Great. In fact, that is so perfect because that's one of the things I wanted to talk about today. I'd say one of the most common messages, calls on AirVet, on anything we get, has to do with GI problems, okay? It's either going to be vomiting and diarrhea. And what's the most concerning? Diarrhea to people, all right? When their pets have this, it's, my dog has soft stool and there's blood. Oh my God, blood. And people panic and they think it's, oh my God, it's an emergency. My dog is bleeding. And truth is that it is 95% of the time not as serious as one would think, because bleeding from the large bowel, we call that colitis, inflamed large bowel. So what happens? Because of issues with, here's the list I run through with people so you can get a better understanding, because I don't want you to panic. I don't want you to run to emergency and spend thousands of dollars and have to wait 6 or 8 hours to be seen for something that wasn't even an emergency. So what are some of the underlying causes? First, I'm going to wave as we talk. We're going to wave. Glad you guys are joining. So nerves, stress, excitement, anxiety, diet change, eating something you shouldn't have, or possibly parasites. If it's a puppy, I put parasites up on that list. Adult dogs, very infrequent, unless, of course, they're going to a dog park or playing with small dogs and maybe picked up Giardia. So bottom line, not that serious. So what is it? So the bowel, because of any of those things, stress, anxiety, excitement, diet issues, it gets inflamed. When it gets inflamed, it stops functioning. One of the jobs of the colon is to absorb the last 25 or whatever % of fluid that's left that was not reabsorbed in the small bowel. So when it gets inflamed, it stops working, it gets irritated, and as ingesta passes through, it's sort of tearing some of the cells, the lining, which is mucus, and that's why you're seeing blood. When you see red blood in the stool, that is coming from the very end of the bowel, which is the large bowel, which is the colon. So you have an ascending colon, transverse colon, descending colon. So that's not the bleeding I worry about. Well, what do I worry about? I worry more when it's black, tarry stool. That tells me there's bleeding higher up in the GI tract, either the stomach, like ulcers, or the small bowel, which could be many things, also inflammation, but it could be intestinal lymphoma. It could be a severe something that is irritated the bowel and made some cuts. By the time that bleeding comes out the other end, it's black and tarry. That is the one that is more concerning to us as veterinarians. So anyway, so what happens is with that, we want to soften the stool a little bit. We want to make it easy for the stool to pass through. We want the colon to heal. And sometimes we can do it without even drugs. I mean, if I'm going to use drugs, it might be metronidazole flagyl. But I like to try just diet at first. So that's where the pumpkin comes in. So you want to increase the fiber. But the problem is you don't want to do it too much, because if you do too much, then the stool is going to stay really soft. It's just enough, a small amount. So pumpkin, cooked oatmeal, cooked sweet potato, cooked yams, bran flakes. The newest one that really the GI people like is psyllium. Psyllium husk powder, pure psyllium. Be really careful if you're going to use the psyllium that comes as a product like Metamucil or Fibrol or Correctol. Read the label, because a lot of times those companies will put in xylitol as an artificial sweetener for people to make it more palatable. Well, for dogs, xylitol we know can be very, very toxic. So you want to avoid anything with xylitol. So basically just pure psyllium husk powder is probably going to be very effective. And that's what I would do that first. Then if that doesn't work by itself, then I'm going to go to maybe adding some medication like a flagyl, a metronidazole. And if beyond that, we may even have to use some zolfidine or some steroids. But as we go up in the aggressiveness of treatment, I like to save those for last, or not my first choice. All right, it's just soft, no blood. So if it's just soft and not runny, then just a little bit of fiber should do the trick. And that is really, that's where I would start. And if the pumpkin didn't work, you could try sweet potato or oatmeal or bran, or just go straight to psyllium. Psyllium powder seems to be the one that most of the GI people like. Ear infection is more common in older dogs. I don't know if it's more or less. Hey, Lauren, how are you? I don't know if it's more or less. I mean, we see ear infections a lot. It's usually secondary to allergy. Here's the thing about ears. There is a beautiful a relationship between normal flora, which is normal bacteria, and normal yeast in an ear, which is normal. And they usually keep each other in check. And therefore, you don't really notice a problem, because the bacteria are out competing the yeast out competing the bacteria, and they reach a balance. What happens? Usually, not as if all the dogs and cats read the books, but the yeast wins out when there's an imbalance. So that's why most ear infections are going to be yeast related. What causes the imbalance? The imbalance could be from anything. It could be some sort of irritation. It could be inflammation. Why? From allergy. So we know that when there's allergic dermatitis, the ears are affected not only from dermatitis, which could be related to atopy, that's inhaled allergens, or direct contact with allergens. Like dogs like to rub their ears on something, rub on grass. That could be an irritation. But the thing that we see most often when it comes to ears, that if we have a dog that continually gets allergic ear disease leading to inflammation, infection, we're thinking that food. So when we think food, I think when I see a dog, whether it's feet, ears, or face, where they're rubbing their face, they're scratching and they're pawing at their face, their feet, they're going after their feet and their ears, that takes food. Remember, it's only about 15 to 20% of all allergies are food related, but that brings food up to more the top. And I'll talk about feeding trials, hydrolyzed protein, maybe a novel protein, getting something, changing the food. So anyway, that is why we typically see the ear infections. It is very common. A lot of times, in fact, now we're treating allergies. Interestingly, as you know, we don't use steroid as much as we used to. We have Apoquel, we have Cytopoint. So we have other medications, and there are new ones out there now too, that are going to attack the JAK1, JAK3 enzyme that works with interleukin 31, or Cytopoint, which attacks interleukin 31. But so we're seeing more of those. But when it comes to ears, and it's interesting because I went to a talk 2 years ago. One of my favorite conferences to go to is called SCICE. SCICE, put on by the Colorado Veterinary Medical Association. SCICE, ski, C-E. And it is a phenomenal conference, really loose, really casual. It's the end of the last week of January. I'm going again this year. I'm a snowboarder, as crazy as I am. And it's a lot of fun. But he was a fantastic speaker. He was a professor in dermatology at, I think, Iowa State. And anyway, he said that even though we're going to new treatments when it comes to allergies, skin allergies, when it comes to ears, don't forget the steroids. He says there's no way when you put the topical ear medicine that it's going to really get to work if there's so much inflammation. We have to reduce the inflammation, not to try to fight the allergy. That's already by other things, to reduce the inflammation. When you do Cytopoint, for example, that is anti-allergy. It is interleukin-31 attacker, but it doesn't remove the inflammation. When it comes to ears, we have to bring that inflammation down. Thus, we still use good old-fashioned steroids. And again, work with your veterinarian. They're great topical ear medicines. There's also things we can put in that have a long-lasting effect. So if you have an animal that's impossible to clean, impossible to treat, we can use things like Ocernia or Claro. So we have some alternative solutions. But steroids may be the key. All right. Can ear infections increase due to diabetes? I'm just trying to think of a link. It's a good question. A link between diabetes, high blood sugar, and I don't know, it could be that indirectly, if the yeast feed on the sugar and there's high sugar in the blood, can it increase the ability of the yeast to outcompete and the bacteria and then cause an infection? Well, it's not a direct causal relationship, but might it? It's a great question. What I can do is I'll talk to some dermoids, the dermatologists, and see if they know of any direct correlation. While I'm waiting for more questions, let me some of the things I wanted to talk about. So first of all, we talked about some of the problems that we see on a regular basis that are more common. So a lot of times over the years, because we have new people joining the show, I don't want to always talk about something we may have spoken about in the future. I try to be careful, but again, I don't want to eliminate things that I know of are important or things that I see or hear on a regular basis. And a lot of times, even if I have spoken about it in the past, if anyone's like me, you forget them after a while and say, oh yeah, I remember he talked about that. And you forget the details. I mean, I always joke that I have a unique skill, a very unique skill. And that is that I can be introduced to somebody, shake their hand, and forget their name all at the same time. So, it's one of those things. Being forgetful is not the end of the world. And as we get older, sometimes it's worse. All right. While you guys get the courage to come up and ask some more questions, we have to break for our show here at Pet Life Radio, halfway through the show. Usually I run overtime anyway. So in the meantime, while you're here on Instagram, come up with your questions and we'll talk about that when we get back. I want everybody to share for it, but we can talk to you during the commercial breaks as well. So Mark, take it away. You can have your commercial break. We'll go from there.
Oh, sure. It's all fun and games until someone ends up in a cone. That's right. We're animals. Deal with it. Pet Life Radio. Let's talk pets. Let's talk pets.
Let's talk pets.
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
And we're back here on Pet Life Radio. We just had a question about food allergy testing. Is a glucose test correct? Is it quite expensive? So what I recommend still, and I believe if I spoke to the allergist, unless there's something very, very new on the horizon that hasn't hit me yet, which is very possible because if I don't have the case myself where we're discussing it, or I'll wait for my next conference and go to a derm talk, or I can talk to my friends who are dermatologists, I'm not sure about any test that's going to work for food. When it comes to food, the best way is one of the more difficult ways, and that is an elimination diet. Now, the best elimination diet is also challenging, could be a little expensive, and that is complete antigen elimination. And those are foods that have basically, they take up the proteins, break them up, so there's no antigen. So it's a hypoallergenic diet. So if you're going to do that, then that is the best way, but it's very impractical. So there's a food out there called the ZD. Now, some of what we've now seen is some of the HP, hydrolyzed protein diets. There are a number of them out there. They are pretty good as well. But understand, during this trial, you're going to need to feed nothing other than that food for 8 weeks. And I mean nothing. So no treats, nothing off the carpet. They can't pick anything up from the garbage. You got to be really, really careful. And if the symptoms, which are mostly face, feet, and ears, seem to improve, then you know you're onto something. Then the next step is to introduce proteins one at a time and see where you get this reaction again. And then you know you cross it off the list. Very time consuming, very difficult to do, very difficult not to cheat. and therefore it's often a failure. So what I recommend as an alternative is looking for novel protein, single antigen diets. What does novel mean? Novel means proteins the dog has never been exposed to before. Things like, we've talked about this, venison, rabbit, bison, duck, alligator. In some places, you can still get kangaroo meat. Things that are so unique. Soy protein. Then, as a single grain or single vegetable. And that could be, again, eliminating the three things you want to eliminate the most in the proteins is the poultry, which is chicken, turkey, and beef. Because most foods over the years have had those three things, and dogs can develop allergies. As far as the grains, eliminate. You want to stay away from corn, wheat, and rice. Now you're left with things like barley and oats and quinoa, things like green pea, broccoli, cauliflower. You want to pick up things that the body has probably never seen before. And as far as your proteins, as we mentioned, anything but the big three, which are chicken, turkey, and beef. And start feeding small amounts of that and increase. But when you do this test, let's say you choose venison, let's say you choose rabbit, that means even the treats that you give have to be rabbit treats and nothing else. So do that for 8 weeks. If it's food related, most likely, you will see some success by doing these novel protein elimination diets. Now, also remember one thing. If the allergy is year-round and not seasonal, then food is higher on your list. But even if it's ears, feet, and face, but if the allergy is seasonal, meaning it's not much during the winter, and you don't change food seasonally, then don't even bother with the food. It's not food. Again, 15% to 20% max of allergies are food-related. All right, my Cloud Chaser. Side point from a malamute is $200 per injection. Daughter's critical care RVT. Doesn't want them on long-term Apoquel because it increases cancerous. Need to reorder your anti-itch. So the anti-itch shampoo is called What Itch, is good. I mean, yes, side point is very expensive, but if you have a malamute, Apoquel is expensive too. There is a new one out there. I'll get you the information on it, and it is supposedly a little safer. I use a lot of Cytopoint. I use a lot of Apoquel as well. I have yet to see a problem. That doesn't mean it doesn't exist. And, when you see cancer, if you have a young dog where cancer is not super common and they're on Apoquel and get cancer, then I think there's a strong correlation. But if you have an older dog, then cancer is going to happen potentially anyway. So I don't know if there's just a direct causative relationship between Cytopoint and the cancer. I'm not saying it's not there, but it's more difficult to prove. But when you get, as I said, if you have Malamute, you're looking at problems anyway. And if you want to try something, and it is seasonal, and you want to go limit it a little bit, go back to prednisone. If you use prednisone judiciously, if you respect the drug, if you quickly get on to an alternate day or every third day treatment and still controls it, then, we've used steroid for years, 30, 40 years, and haven't had issues. It all depends on how it's used, how you respect the drug, and the health of the pet. A Malamute, older Malamute, should be checking anyway. Once a year, once every 6 to 8 months, if not every 12 months, blood tests, make sure they're okay. So anyway, that's what I would recommend. Bumps on legs are more indicative of topical allergies, right? Yes. When you have anything that's feet, face, ears, usually point to potential food allergy. There could be overlap. Trust me. As I joke, the dog didn't read the book. Dog doesn't know how it's supposed to have the allergies, what the symptoms may be. But the general rule, those are the big ones, feet, face, ears, for food. If you have lesions, thighs, abdomen, lower back, I'm thinking fleas, then there's a strong likelihood. And another thing, if it is pollens, you usually get a better response than is any of the anti-allergies other than the food ones. So that's why yes, it's possible. I wouldn't hang my hat on it. All right. Hey, Deb, you joined me late. Another thing you can think about, if you're having a dog and you are trying to eliminate the allergies, this might be a good case for allergy testing. It's a blood test. I don't know, depending on who does it, anywhere from $400 to $450. Find out what they're allergic to, get the serums, and start desensitizing. That still is the gold standard. Instead of needing these drugs, do the test. Once you have the test, you know exactly what they're allergic to. You start to desensitize with the serums or sublingual drops. I prefer the serums, the injections. Why? Because you start routine daily, every other day, I think. It's not never daily, it's every other day. And then you go up, you keep giving a little bit more, and then you start spreading out from every other day to once a week to 2 weeks to a month. And then when you finish that lower dose vial, you get to more concentrated stuff and you start all over again. And you finish the second vial, you go to the third vial, which is the final vial. And that you do the thing again. You get to the point in about 4-6 months, whatever it is, your maintenance is a shot a month. It's so easy. Think about it. If you have a dog that has diabetes, you're giving injections every day, twice a day. So to have to do it once every other day and then once every 3 days, et cetera, it's not the end of the world. It's subcutaneous. It's easy to learn. The needle is super thin. And that is the best way to go. Now, what happens though, you have to understand that when you get to maintenance, then you're doing once a month, which is the good news. Now, there is a new alternative. It's not new anymore, but it's been around for a while. Sublingual drops. But here's the thing with the drops. Sublingual drops, very convenient. It's a drop under the tongue, in the mouth, once a day, forever. So you never get to start increasing the dose and decreasing the amount of time in between. No. When it comes to the drops, it's 1 drop or 2 drops, whatever it is, under the tongue for the rest of the pet's life. So 365 days a year. I mean, I think that's more challenging than the injections, because the injections a little more challenging at the beginning. You have to learn how to give a shot, and you have to do it every other day, but it decreases. The time between injections increases, and then I think in the long haul, my opinion, again, who am I to talk? I'm a veterinarian. I give shots to animals every day. For me, it's a piece of cake, but for others, it may be a little more challenging, or you have a dog, there's no way you're going to give a shot at home, in which case you can get the drops. But as far as a long-term therapy, that is the best way to go. 6 years old, decided to break the bank. Yeah, 6 years old is kind of young. Not young for allergies, but I see what you're talking about. I would think about doing the allergy test. We do it. We send it off to the lab. We get a result. They make the serums. We teach you how to give shots. Big malamute shouldn't be a problem. That way you will, as you said, in the long haul, the hope is to build up the dog's own immunity to those allergens. And then, I had allergy shots as a kid. In fact, I tested positive as a kid. Dogs, cats, horses, sheep, goats, cows, and hay. Also wheat, and which I live on. I love pasta. Also some fruits and vegetables. Eggplant, for example. I love eggplant parmesan. So I have 0 allergies. Now for me, I don't know why did I outgrow them. Through vet school, though, I was still allergic. But my best thing for me, because cats were my biggest allergy, I got a cat. I've had as many as 5. I just lost Ollie, I lost one Munchie about 1.5 years ago. I lost Ollie about 2 months ago. And so I have 3 now. And yes, looking for 1 or 2 more. My wife will kill me if she hears me say that. But anyway, I have 5 dogs. It was so perfect when I had a balance of 5 and 5. Then nobody can accuse me, oh, you like dogs better. No, I don't like them both the same. But it all just depends on just getting the right one. But yes, now I have the 3 cats, the 5 dogs. So anyway, I basically outgrew my allergies, or I think, honestly, getting a cat. That was the best thing I ever did, because I think getting that exposure every day to one, single cat. His name was Gimpy. We adopted him because he was adopted. He had some sort of leg injury, and he had a little subtle limp. But it wasn't so much the limp. It was every time he would take a step in a quiet room, you could hear the click, click, click. So something in his joint was clicking, and he had that limp. So we called him Gimpy. He was such a great cat. And then after that, we just started getting more and more cats. And then I, as I said, had as many as 5. So again, when you talk to allergists, interesting, they say that some people, when they hit adolescence, they could outgrow their allergies. But I still had my allergies as a 20-year-old, 24-year-old. I started vet school when I was 25. I still had the allergies. But going through vet school and having to go through my large animal rotations where I was getting the horses, sheep, goats, and cows and bedded on hay, I was a little bit of a wreck. But now I have 0. So I have no idea what it is. I can't say. All I know is being a veterinarian, I am way happier not being allergic to all these animals than being allergic. Because when I was in vet school, I was a wreck. Everybody knew if they needed tissue, let's go ask Werber, because he definitely had tissues. Every pocket on my coveralls had tissues in them. All right, we're getting towards the end of our show. We're actually at the end of our show. Any last questions before I see you next week? And again, how to get hold of me during the week. You can get a hold of me anytime. Very easy. Get a hold of me on AirVet. If you haven't signed up to AirVet, sign up, tell your friends. Here at Pet Life Radio, a wealth of pet information. And it's not just my show. There are so many shows. Even Mark, how many veterinary shows do we have hosted by vets? 5. There are 5 shows. You should listen in because you're going to learn so much. And I'm talking really, really great hosts that know their stuff. So a lot of the stuff, most of our shows are going into podcasts. So you can call them up anytime, listen to old shows. I have, Mark, how many 500 shows in the can? I think so, because I had my 500th. Yeah, about 500 shows. There's so many things you can learn from me and from other veterinarians on Pet Life Radio. So, tune in, tell your friends about Pet Life Radio as well. And then those of you who know me well, you probably have my phone number. Yes, I'm pretty easily give out my cell phone, much to the dismay of some of my family and much other veterinarians who think I'm insane. But I got to tell you something. The best way to develop long-term relationships is be accessible. When my clients know in a pinch they can reach me, then that's phenomenal and it makes me happy as well. And of course, AirVet, you can reach a veterinarian 24/7. So anyway, easy to get a hold of. You can catch me here every Sunday morning on Instagram. You can also send me direct messages on Instagram, on LinkedIn, on Facebook. I mean, it's all there. So there's no excuse not to get a hold of me. I don't want you running to emergencies because I will tell you, most of my clients that are frustrated with the emergency situations, the emergency hospitals that we have, especially in Los Angeles, they're frustrated because they went there, they spent a fortune, and then they found out after the fact that they overspent. They didn't need this test. They didn't need that test. They didn't need to wait. As a matter of fact, they probably didn't need to go at all. So take advantage of the wealth of information that's out there online, on AirVet, here on Pet Life Radio, and you will definitely save yourselves a lot of money, a lot of headache, and a lot of time. Anyway, don't go away. I mean, you go away now, but we'll be back next week. Same time, same channel, here on Pet Life Radio, here on Instagram, and would love to have you join the show. Tell your friends and come equipped with questions. During the week, if you think of something, you say, I want to ask Werber, just write it down. Come on Sunday, and that way everybody can benefit as well. Have a great week, everybody. See you next Sunday.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.